So this is the middle to end of December 2015. This piece is about an incident that arose from a visit to accident and emergency in my local hospital, which was necessitated arising from some kind of an abscess, dental type problem. And I was directed to go to the accident emergency, so I didn't want to go there. I was sent there in early hours in the morning. Here is the parking ticket, which is upside down to me, but that's the way this works. It should be right way up to you. So it says 3:47 is when I can park until. So I arrived at 2:47. That's in the morning. 2:47 in the early hours of the morning on Friday the 6th of November. So 2015. So that's Bonfire Night in this country, United Kingdom. So I went to accident emergency based on having had bad toothache and a visit to the dentist. The dentist thing turns out to be incidental to what happened, but it's what initially was the problem. And in essence, they couldn't remove or do anything with the tooth. It was too painful, so they basically sent me away with antibiotics, which is meant to calm everything down. Then you can either set to work doing a root canal, or they can remove the tooth. Either way, it gets fixed. The anaesthetic doesn't work very well if you've got an abscess in the tooth. So, you know, you've got to have the antibiotics first if there's a problem of inflammation and abscess and swelling and all that stuff, all that horrible, ugly stuff, yucky stuff needs sorted out before they can really get the anaesthetic to work and then work on the tooth. So what happened was, I've got some notes here, some little bits and pieces. Eventually I got some antibiotics that worked, and that was a couple of visits to the dentist to get that sorted. But like I say, all that's a bit of a distraction to what actually occurred later. Because I'm already on painkillers for a fundamental illness I've got that you can't fix, it's incurable, a degenerative illness I've got. I'm already on painkillers and anti-inflammatories and all sorts, so they can't really give me many more painkillers that are any stronger, not easily. You'd have to go up to morphine or something. So I rang up in the early hours of the morning on Bonfire Night, Friday morning as it turns into, and about 1 AM in the morning or something, I'm calling up and ringing 111, which is our non-emergency emergency service. It's kind of an advice line or whatever that the NHS in Britain run. So I ring up and I basically get told, well, you know, you're taking too many painkillers. And unfortunately, they send me to accident emergency. Now, I knew accident emergency wouldn't do anything for dental, which is what I pointed out to the lady on 111. Now, this 111 service gets slagged off incredibly in this country, so I don't know if I should say much else about it. Anyway, I said, well, if you really want to send me there, I'll go, because I wasn't able to sleep because of the pain anyway. If you want to send me there, I'll go, I said, but they don't do dental. So, okay, so I end up there, and as the parking ticket says, I get there for 2:47. I couldn't park right next to it anyway, so I had to go further away, pay to park, then I come back. And then in the end, I was seen by 3 people, okay? It took an hour to see me even though the place was empty. Now, I'm not saying that they were catching up on sleep in some other part of the place. I'm not saying they were, and I'm not saying that that's an awful thing either. It's a common practice in nursing to do that. I'm not saying anything about that. I'm saying it's possible that was what was happening, but nobody was around. So I was there for an hour waiting. They finally get me in. I get taken in by one nurse who sits me down. Another nurse comes in. Now, I only know first names, so I'm going to say the first names. This is Dewsbury accident emergency. So Wendy comes in. She takes down she says, what painkillers are you on? And of course, 111 service must have directed them to a very narrow focus of what they should talk about. And she didn't want to know about any of my other drugs. Okay, fair enough. So I started on about what painkillers, you know, and then I started talking about diclofenac, which is anti-inflammatory. She said, no, just the painkillers. Okay. So Wendy goes off. So if I had anything to level at Wendy, which isn't very much, it's that she focused too narrow on one thing, but she may have been directed to do that. So, okay, let's say that Wendy did what she was directed to do. Nurse comes in, Alison, nurse comes in. She has in her hand, as she comes into the cubicle, an ear thermometer, which is a kind of little right-angled thing, and they stick it in your ear with a little tip on it. Now, I assumed that this is where I got the illness that I subsequently got, which we're talking about gastroenteritis, incidentally. If you don't know it, Google it, but gastroenteritis is an infection of the gut. It can be caused by Campylobacter, it can be bacterial or viral. Kids have it, tend to be rotavirus that they have. It's vomiting, throwing up, headaches, fever, dehydration, diarrhea, eventually, all of that horrible stuff. It lasted a month. Okay, so to get back to the thing, it is possible to get it through an ear infection. So I assumed that was what this was that happened, but remember at the time I had no idea what happened. So she sticks it in my ear and then goes away. Now she quickly, as I had my eyes locked onto this ear thermometer, she quickly slaps it in the box and pushes off, and I thought, now she didn't like me looking at that thermometer going in the box. It's a bit like she knew that I was locked onto it and that I thought something was up. To me, they should come in with a clean little packet, they open it up, a new tip, they put it on the thermometer and put it in your ear. Instead, I got somebody come round in the cubicle, this nurse Alison. She has the ear thermometer already out and the tip already on it. Then it's in my ear before I can say, anything, and then it's removed and whipped back in the box. Now, that's not really a protocol that I would have thought was advised. Okay, that's Alison's bit. Nick, the consultant, comes round. Nick's idea is that he just has a look at me. He comes in with these gloves, right? These blue gloves. He elbows his way in through the curtain into the cubicle, and he's got his blue gloves, so he's already like this. So this man's already put his gloves on. Now, that's the question I'm going to ask now of this consultant. How long did he have the gloves on for? They looked to me like they'd been around for a while. Anyway, he starts prodding around at my mouth, and I cannot remember if he went in my mouth, I just went round it, but his hands touched my face, right? With those blue gloves on. We went out of the cubicle after a bit. He disappeared, I think, came back with 2 ibuprofen and water, so he definitely went out and came back and still appeared with the same blue gloves on. You could argue I couldn't possibly know they were the same. He was still going around like that, and, When I walked out with him to the desk, because he wanted me to fill in his satisfaction slip, he was able to point me to a special dental emergency thing. Now bear in mind I went in with an abscess, massive pain problem. Apart from a 2 ibuprofen which do nothing compared to the painkillers I'm on, he's really only able to give me 24-hour number, which is that number there. 01924 blah blah. Because we're in Dewsbury area for the accident emergency. I rang that emergency number when I got back home, and they said ring 111. That's at 4 AM. So I've been in agony for days at this point. So that's where I started, and they sent me to A&E, and I got 2 ibuprofen and a glass of water, which is like them saying, that's the equivalent of saying you're a time waster. Sorry, that's what that says. Then later on, over the next day or so, I got incredibly ill. I was feeling kind of nauseous, and it took about a day to really get going, and by Saturday morning I had a sip of water, I thought it was a few sips, and it all came out. So I sent them a report. The report is here. Here's the report. It's a few pages thick. I'm just typing my address on it. So I've recorded it, recorded delivery and all that stuff. It went to the chairman of the board, Jules Preston, MBE. It went to the chief executive, Stephen Eames. It went to the medical director, Dr. Karen Stone. It went to the chief nurse, deputy chief executive, Sally Napper. It went to the acting chief nurse, director of staff and patient engagement, David Melia. It went to director of operations, Mike Forster. It went to associate director of operations, Phil McNamara. It went to clinical director, Dewsbury, because that's where the accident emergency is that I got this gastroenteritis from, and that is Sarah Robertshaw. It went to urgent care lead, Dewsbury, that's Helen Hayden. I went to Head of Service, Emergency Assessment Dewsbury, that's Richard Shepherd, and I went to Head of Service, Emergency Department, also already mentioned as Clinical Director of Dewsbury, Sarah Robertshaw. Okay, that's 11 people in all, or maybe it's 10 if one of them seems to do 2 jobs. I pointed out in a full report, I sent him a letter about it, pointed out in a full report what had happened. This illness altogether lasted for 4 or 5 weeks, and I was sick as a dog. And I was completely out of action at the time. My family really needed me, and I had quite a few commitments to do with family. And it was Bonfire Night and Bonfire Weekend, so it would have been handy if I could have been around. I hate to think what would have happened if an emergency with my children had arisen. It is my view that the issue with not taking down all my drugs is just a technical issue. The real problem is that I got an infection. The timeline says it was from that visit to accident and emergency. A medical professional has looked inside my gut and told me the inflammation looks awfully like gastroenteritis, and we discussed my symptoms. So that's a medical professional's view, not mine. And the timeline is that it's bang on when I was at A&E. A few hours later to a day or so later for those symptoms to come on. Everything else is a constant. Okay. Now they've contacted me back. The Mid-Yorkshire Hospital Trust, which is who this is. They have contacted me back, and I've had two matrons call me. You'll notice that no matrons are on that list I gave you of people I sent this information to. And the matron they're going to have to investigate it is the matron who is in charge of the department that would need to be investigated. That is Dewsbury Accident and Emergency. Dewsbury District and General Hospital Accident and Emergency. It's run by a matron, and that lady is the lady who's meant to investigate this. Well, she's not going to find anything, is she? It's on her watch. How is she going to find anything wrong? At least pick someone who's in charge of A&E, but from a different hospital. But they don't even go that far. So this is really pushed down the food chain as far as the NHS Trust is concerned. I thought it was quite important for you to go in and get something like that. Look, the fact is it could be Ebola, it could be anything. And even as I say that, I can hear the Trust members laughing and saying, oh, Ebola, right? It could be anything that you get. The fact is, in this case, it was gastroenteritis. I went in with a toothache. I was already in massive pain. I already have an underlying health condition. They sent me out with gastroenteritis. And that guy Nick, wandering around with these blue gloves, for the sake of a 20p pair of rubber gloves. That guy's been going, where were those? I saw him, and for 20 minutes, maybe 30 minutes, he had that same pair of gloves on. Now this ear thermometer thing, they seem to get a cartridge system. They've got like a magazine on the wall and they clunk it in and it fits a new one. That I would have thought was suspect. The only way to be sure is that when they appear in that room, in that cubicle, the guy puts his gloves on there and she puts the piece on the end of the ear thermometer out a plastic packet there. Anything else, they've been wandering around with those gloves on with that earpiece hanging out on the end of the thermometer. Or worse, it's been used on someone else first. Okay. So 4 or 5 weeks out of action, and their answer for an investigation is not going around swabbing everywhere, but to phone me up and to try and suggest it could be airborne, I could have got it anywhere, blah blah blah, right? I got this from that filthy germ hole that is Dewsbury District and General Hospital's Accident and Emergency Department. Guys want its consultants, paid 50 grand a year, wander about with rubber gloves on that they haven't changed for hours. And somebody with an ear thermometer that they don't care if the tip's fresh or not. That's what I've had at Dewsbury Accident and Emergency. Now they can come back to me and say whatever, but I want to know that something proper is taking place. One more thing on this. There is now, by a parliamentary committee, a serious criticism now, a report out criticising the way that NHS hospital trusts run complaints and investigations that follow up complaints. And one of the things they say is that people in the place investigate the complaints against themselves. Okay? Guess what? They find themselves not guilty. Okay? And when I asked the matron about this that rang me up, she said, oh, I've heard of it, I haven't read it yet. And I thought, well, I'm a nobody, love, and I've heard of it and I've read it cover to cover. Okay? She's in the business and she ain't read it. What does that tell you? Thanks for watching and listening.